Hello everyone, and welcome back to our channel. A growing outbreak of a gastrointestinal illness known as Cyclosporiasis is spreading across the United States, raising concerns among health officials and consumers alike. This foodborne infection is caused by a microscopic parasite called Cyclospora, and according to the US CDC, cases have now been reported in 31 states. So, what exactly is Cyclospora? Cyclospora, or Cyclosporiasis, is a microscopic, single-celled parasite that infects the small intestine. Even though it is far too small to be seen with the naked eye, it can cause a very unpleasant illness known as cyclosporiasis. One of its most recognizable symptoms is watery diarrhea, which may occur frequently and, in some cases, can be explosive. However, diarrhea is only part of the illness. People infected with Cyclospora may also develop bloating, stomach cramps, nausea, fatigue, loss of appetite, and sometimes fever. Unlike many foodborne illnesses that appear within a day or two, Cyclospora symptoms often do not begin until up to 2 weeks after exposure. Once they begin, they may continue for several weeks or even as long as 2 months if the infection is not properly treated. Historically, and in the current investigation, several foods have received particular attention. These include bagged salad mixes, pre-cut leafy greens, fresh herbs such as cilantro and basil, berries including raspberries and blackberries, as well as vegetables like snow peas and green onions. These foods are often eaten raw, which means the parasite is not destroyed by cooking before consumption. Compared with other foodborne illnesses such as Salmonella or Escherichia coli, commonly known as E. coli, Cyclospora infections are relatively uncommon. For many years, only a small number of outbreaks were reported annually in the United States. The current outbreak also serves as an important reminder that foodborne illnesses are not always caused by bacteria or viruses. The outbreak has spread widely across the country, but several states have been affected much more severely than others. Michigan has experienced one of the most dramatic increases. In just a 2-week period, more than 1,000 people were diagnosed with cyclosporiasis. To put that into perspective, Michigan usually reports only about 50 cases in an entire year. Such a dramatic increase highlights how unusual this outbreak has become. Public health experts believe the true number of infections is almost certainly much higher than official reports suggest. Many people experience mild symptoms, recover at home without seeking medical attention, or are never tested specifically for Cyclospora. The CDC reports that no deaths have occurred during the current outbreak, but 86 people have required hospitalization, showing that although the disease is usually not fatal, it can still become serious enough to require medical treatment, especially for vulnerable individuals. According to the Infectious Diseases Society of America, IDSA, diagnosing Cyclosporiasis requires specialized laboratory testing because the parasite is not always detected during routine stool examinations. Recommended diagnostic methods include a modified acid-fast stain performed on concentrated stool specimens, ultraviolet fluorescence microscopy, and nucleic acid amplification testing, commonly known as NAT. The joint IDSA and American Society for Microbiology, ASM, 2024 Laboratory Utilization Guide also recommends using modified acid-fast staining together with NAT to improve the detection of Cyclospora infections. Once the diagnosis has been confirmed, treatment should begin promptly. According to both the CDC and clinical evidence from randomized controlled trials, the recommended first-line treatment is trimethoprim sulfamethoxazole, commonly abbreviated as TMPSMX. For immunocompetent adults, the recommended treatment is 1 double-strength tablet containing 160 mg of TMP and 800 mg of SMX, taken twice a day for 7 days. Clinical studies have shown that this treatment is highly effective. It not only resolves diarrhea but also eliminates the shedding of parasite oocysts in the stool, reducing the risk of ongoing infection. Evidence supporting TMPSMX is particularly strong. In one randomized clinical trial involving patients living with HIV, every patient who received TMPSMX experienced complete resolution of diarrhea, and 95% had negative stool examinations by the 7th day of treatment. However, treatment recommendations are different for people with weakened immune systems because they have a much higher risk of prolonged illness and recurrence. For HIV-positive patients, the recommended regimen is TMPS-MX double-strength tablets 4 times daily for 10 days, followed by secondary prophylaxis with TMPS-MX 3 times each week to reduce the chance of relapse. Similarly, for solid organ transplant recipients, the American Society of Transplantation, AST, recommends the same intensive treatment approach, followed by long-term secondary prophylaxis. Because transplant recipients take medications that suppress the immune system, they face a greater risk of recurrent Cyclospora infection after initial treatment. For patients who are allergic or intolerant to sulfa drugs, ciprofloxacin may be used as an alternative. The recommended dose is 500 mg by mouth twice daily for 7 days, followed by 3 times weekly dosing for secondary prophylaxis when appropriate. However, patients should understand that ciprofloxacin is less effective than TMPS-MX. In clinical trials, diarrhea resolved in 87% of patients receiving ciprofloxacin, compared with 100% of those treated with TMPS-MX. Stool clearance was also lower, reaching 70% with ciprofloxacin compared with 95% for TMPS-MX. Another possible alternative is nitazoxanide, especially for patients who cannot tolerate either sulfonamides or ciprofloxacin. However, current evidence supporting nitazoxanide is limited, and it does not consistently produce successful results in every patient. For children, treatment is adjusted according to body weight. The recommended pediatric dosage is TMP 5 mg per kilogram and SMX 25 mg per kilogram per day, divided into 2 daily doses. As there is currently no vaccine available to prevent Cyclospora infection, health officials are encouraging both consumers and restaurants, particularly in affected areas, to take additional precautions when handling fresh produce. One important recommendation is to choose whole heads of lettuce instead of pre-washed bagged salad mixes whenever possible. Removing and discarding the outer leaves may further reduce the risk of contamination. Fresh fruits and vegetables should also be washed carefully under plenty of running water. Firm produce such as melons and cucumbers should be scrubbed with a clean produce brush. Whenever possible, cooking is one of the most effective protective measures because thorough cooking destroys the parasite. Foods that can safely be cooked before eating generally carry a much lower risk than raw produce. Another simple but important food safety habit is proper refrigeration. Cut, peeled, or cooked fruits and vegetables should be placed in the refrigerator within 2 hours of preparation to help maintain overall food safety. At the same time, anyone who develops persistent watery diarrhea, especially after eating fresh produce or traveling to areas where Cyclospora is more common, should seek medical attention. Early diagnosis and appropriate treatment can shorten the illness, reduce complications, and help prevent unnecessary suffering. That is all for today. If you found this video helpful, please give it a like, subscribe to our channel, and turn on the notification bell so you never miss our latest updates. Thank you very much for watching, and we will see you again in the next video.